This is going to go over pharmacokinetics, or what your body does to the drug. So, as soon as you start giving a medication, the body starts removing it. This whole thing is the principle of pharmacokinetics. It's the study of how medications enter the body, reach their site of action, and eventually are eliminated from the body. Now, the duration and effectiveness of the medications are going to be determined by the dose, the route of administration, and the overall clinical status of the patient. When we are choosing a route of administration, it has to allow for delivery of the appropriate amount of medication to the right location. And a lot of different factors affect that. It could be a physical or chemical property, such as the solubility of the medication, the concentration of the medication, the pH of the medication, the pH of the body. It also could be determined by the routes of administration, the site of absorption, the absorption surface area. If it's an IM injection, and the patient's experiencing some shunting due to hypoperfusion, that IM injection may not be adequate anymore. And then we're looking at the blood supply to the site of absorption and how quickly the effects are needed, the bioavailability. So how fast does this medication get in the body and actually start working? Now, when we're looking at distribution of the medication, we're looking at how the medication moves through the body, and once again, this is determined by some chemical properties, some physical properties, and some patient factors. So some things like cardiovascular function of the patient. If that patient has in cardiac arrest, unless we've got some good CPR going on, you're not going to have adequate blood circulation. Regional blood flow affects it a lot as well. Medication storage reservoirs. If the liver is a store and they're hepatically insufficient, then guess what? You're not going to have adequate stores of medication. Other physiological barriers. You've got 3 potential barriers within the body, and this is the blood-brain barrier, which everybody has, and then the blood-placenta barrier and the blood-testes barrier. Now, with biotransformation, this is just metabolism. This is how the drug is changed into a different form by the body. So it's chemical alteration. Now, some drugs, this might make them become therapeutic or ideal level. Most of this biotransformation is going to take place in the liver, but it occurs, in all the cells and tissues to some degree. Now, when we're looking at the biotransformation, a couple of different effects that can have. It could have an inactive substance become active. It may make an active medication change into another different active medication. You could have an active medication that became inactivated, or you could have an active medication that's transformed into a substance that's easier to eliminate, so it may become more water soluble or something like that. So medications are going to be eliminated either in their original form or as a metabolite. Medication excretion is just the movement of this tissue or this medication from the tissues back into circulation and then to wherever they're going to be removed. Now, there's several different ways that the medications can be excreted. It may be in bile from the liver, it could be in the intestines as feces, it could be expired air through the lungs, but the primary one is going to be the kidneys as urine. This is why if you've ever done a drug test for work, they test your urine. This is what they're looking for, is these metabolites of these drugs. Now, when we are talking about your elimination, you've got 2 different types of elimination. You've got zero order and first order. Your zero order elimination means that there is a set rate of elimination no matter how much is in your body. Your body's going to excrete this much of it this often. And then your first order elimination is based on basically percentages in the plasma. So the higher the concentration of the plasma, the harder your body is going to work to try to eliminate it. And this is actually most of your medications. A couple other ways that medications can be excreted would be through your sweat, through your saliva, through your breast milk. This is why if you've ever been around somebody who's had a little bit too much alcohol to drink the day before, the next day they kind of smell like it's coming out of their pores. It literally is. For your breast milk, this is why some medications say don't take if you're breastfeeding, because it may cross through the breast milk and we don't want to accidentally give that infant that is breastfeeding a dose of that medication. And medications can also be artificially removed. This would be through dialysis, hemodialysis, or peritoneal dialysis. Most of the time, if somebody is on dialysis, they're going to alter their medication dosages, but they can also go in and do hemodialysis on somebody who is not in kidney failure, just specifically to remove some of the medications as needed. So, quick review. Pharmacokinetics, what the body does to the drug. Once the drug gets to the receptor sites, changes happen, actions happen. We're looking at the absorption, distribution, and metabolism and elimination of the drug within the body. So absorption factors, circulatory status, solubility, the body's pH, the concentration of the drug, and the bioavailability. For distribution, we're looking at how much drug do they get, the dose, how did it travel through the body, is it bound in proteins, is it in plasma. Elimination, we're looking at do they have adequately functioning elimination methods, do they make urine, are they constipated, are they sweating, are they breathing. Alright, so go on, check that, follow that link to Kahoot, check it out, let me know how you did.